Hi, my name is Caprice Rengifo and I'm going to talk about Hepatopulmonary Syndrome. Definition. Hepatopulmonary syndrome is the most common cause of respiratory insufficiency in patients with chronic liver disease. It's a complication of portal hypertension defined by the presence of liver disease, abnormal pulmonary gas exchange, and evidence of intrapulmonary vascular dilatations, producing a right-to-left intrapulmonary shunt. Croca observation. The Dr. Michael J. Croca added precision to this definition, observing that the syndrome can coexist with cardiopulmonary diseases and can also appear in cases of hepatitis, portal hypertension not associated with liver cirrhosis, alpha-1 antitrypsin deficiency, and Wilson's disease.
I am Michael Croca. I am a pulmonologist at the Mayo Clinic, and I do consultation in the liver transplant program, helping the liver transplant surgeons and the hepatologists deal with lung problems in the patients that are going to have a liver transplant. The topic today is hepatopulmonary syndrome, which is a very specific lung complication of liver disease. And this particular complication results in the patient being short of breath and having very low oxygen levels because of a very complex relationship between the liver and the lungs. Patients with hepatopulmonary syndrome generally begin with a liver disease, and over time they find themselves more and more short of breath. With chest x-rays it may be normal and no other major finding. They may note that their fingertips turn blue. They may note that their finger size becomes clubbed, and further evaluation suggests that indeed this syndrome may exist. We make the diagnosis by doing a sound wave test of the heart, which can assess whether or not there are pulmonary blood vessel abnormalities in the lung, and we also measure arterial blood gases, which gives us an idea of the actual oxygen level in the bloodstream. Once we make a diagnosis, it's very important to try to improve the symptoms, and we have the patients wear supplemental oxygen if indeed the oxygen level is seriously low. And more importantly, we try to define what the best treatment is. There are no medications that help with this syndrome to the best of our knowledge and our experience so far. The good news is, however, that with a successful liver transplant, all of these blood vessel problems in the lung that causes the oxygen level to be low do resolve, and they reverse. And it may take many weeks or months after a successful transplant.
Applications in medicine. Causes. The exact pathogenesis of hepatopulmonary syndrome is still unclear. Inequality of ventilation perfusion ratio, pulmonary shunt, and gas transferring limitation are three possible pathological factors responsible for pulmonary complication in hepatopulmonary syndrome patients. These three factors are mainly resulted from irregular intrapulmonary vascular dilatation and also increased numbers of these dilated vessels. One of them is the nitric oxide synthesis, pulmonary angiogenesis, and endothelin-1 are the main factors responsible for pulmonary vascular bed alternations in HPS patients and also the target of various treatment strategies.
Hepatopulmonary syndrome. It's a disease in the pulmonary caused by the hepato. So liver disease leading to pulmonary disease. The liver is cirrhotic. Cirrhosis leads to secretion of vasodilator material, cause the blood vessels to dilate. Okay, also this will lead to decreased oxygen going to the lung, leading to hypoxia. This is an oxygen tank and decreased in this patient. Also, you will have something called platypnea orthodeoxia. It's that the patient has dyspnea on sitting down, and this dyspnea may disappear when he lie down back on the bed. So this is called platypnea and orthodeoxia because there is hypoxia in this position. So this position is called platypnea and has hypoxia, so it's called orthodeoxia. So this is the triad of hepatopulmonary syndrome. You have cirrhosis, you have a patient with orthodeoxia or platypnea, and also there is hypoxia. How to diagnose? Contrast echo, and also you can use technetium albumin. Hepatopulmonary syndrome, cirrhosis, hypoxia, and platypnea. Diagnosed with contrast echo and technetium albumin.
Hello everyone, I am Dr. Prashant, and in this presentation we will talk about hepatopulmonary syndrome. Diagnosis of hepatopulmonary syndrome requires a high degree of clinical suspicion and involves arterial oxygen saturation monitoring. We can also go in for detection of intrapulmonary shunting. Let us now take a look at the technique for diagnosis of hepatopulmonary syndrome. This is a jar of or a bottle of saline which is agitated or shaken from side to side, resulting in the formation of these bubbles as shown here. These bubbles are now injected into the vein of the patient. The bubbles are now in the vein of the patient. Now, let us orient ourselves with this diagram. This is the superior vena cava, this is the inferior vena cava, this is the right atrium as labeled, and the other chambers are labeled as well. Now, in a normal individual, when the bubbles reach the inferior or superior vena cava, they would reach the heart on the right side, and from the heart, they would go through the pulmonary artery to the lungs, where they would get absorbed in the lung. In a patient with intrapulmonary shunting, when the bubbles reach the right side of the heart, they would travel this intrapulmonary shunt and show up on the left side of the heart. If there are bubbles on the left side of the heart in more than 3 but less than 6 cardiac cycles, then this is diagnostic of hepatopulmonary syndrome.
This is an image shows thoracic echocardiographic features of the hepatopulmonary syndrome. In the next video, I'll actually explain this. Pros and cons. The pros: there are few options for treatment. One of them is the liver transplantation, is the more efficient. The second one is supportive oxygenation, and the last one is intrahepatic shunt. The cons: post liver transplantation, 80% and 85%, the patients will have improved oxygenation and decreased AV shunts. However, certain patients can develop complications. These complications are refractory hepatopulmonary syndrome. These patients fail to improve oxygenation or develop recurrent hepatopulmonary syndrome after liver transplantation. The second one is severe post post-transplant hypoxemia is a failure to maintain oxygen saturation above 85%, even on 100% oxygen. Then the last one is the more rare, is post-transplant portopulmonary hypertension.
Portopulmonary hypertension is a subgroup of group 1 pulmonary arterial hypertension, and it occurs in the setting of hepatic cirrhosis, or what's commonly referred to as end-stage liver disease. And when that happens, the circulation from the GI tract through the liver gets congested, and that's referred to as portal hypertension. It produces fluid in the abdomen, ascites. It can produce a lot of collateral circulation in the GI circulation called varices, and that has a high association with development of pulmonary arterial hypertension. So when you have both together, that's called portopulmonary hypertension. Patients with end-stage liver disease can have other causes of pulmonary hypertension which do not involve narrowing of the pulmonary vessels, and the specialist has to sort that out. And it generally involves a right heart catheterization to determine whether the pulmonary hypertension is there because the patient with hepatic cirrhosis is retaining too much fluid, or perhaps they have what's referred to as a high cardiac output state, but they may very well have portopulmonary hypertension. If you look at populations of patients that are referred for liver transplant, maybe up to 5 or 6% of those patients have portopulmonary hypertension that's discovered during their evaluation for whether or not they might be eligible for a liver transplant. In terms of the risk for developing pulmonary arterial hypertension, it's really that setting that I just described. It could be that they have some skin manifestations, what's called spider angiomas, that might be similar to what I've described with the telangiectasias that you see in connective tissue disease. That might be prevalent or more prominent. But in general, it's an assessment of whether or not they feel like they've developed cardiopulmonary symptoms of shortness of breath.
Issue of playing a card. In an article published in 2019 by the magazine Sensibilidad that talks about epidemiological profile of the hepatocirrhosis, puts in evidence that thanks to the INEC in 2014, the 7th place cause of mortality was a hepatocirrhosis that developed consequently in a hepatopulmonary syndrome. Conclusion. HPS is a frequent complication for these patients, and although it is generally asymptomatic, it does have an impact on their quality of life and survival. It has also been established that liver transplant is an efficient method of treating the syndrome and has positive post-transplantation survival results, even in severe cases. Thank you.